I'm Sabrina Zatola.
And I'm Alexa Arnold.
I'm Rachel Kendall.
And I'm Sarah Crawford.
And today we're going to do a video on IM and subcutaneous injections.
An overview of how to give IM and sub-Q injections. Reasons to give medications by injection is for rapid action, drugs altered by intestinal secretions, patients who cannot take oral drugs, and drugs that do not come in an oral form.
When giving subcutaneous injections, there's some possible complications. Long and short-term nerve damage, intramuscular hemorrhage, hitting a blood vessel, and lipodystrophy is some common complications. With subcutaneous injections, local blood flow to the tissues affects the rate of absorption. Exercise and heat and cold application also influence blood flow. When giving injection, the site you choose affects the rate of absorption. Insulin given into the abdominal area 2 fingers away from the umbilicus is the most quickly absorbed site. Then the arms, thighs, and then finally the buttocks is where the slowest rate of absorption is.
This scene is going to be about subcutaneous injections. First, you're going to obtain a 1/2 to 5/8 inch needle. The orange is for insulin, and the brown is for heparin. These can be given in the deltoid abdominal area, upper hips, lateral upper arms, and thighs. When administering a subcutaneous injection, cleanse the skin with an antiseptic wipe using a circular motion, beginning with the center of the site and moving outward. Allow the site to dry before administering the injection. When giving the injection, it's important to lift the skin fold and puncture the skin at 90 degrees if the patient is of average size or obese. If the patient is a thin, malnourished adult, give the injection at 45 degrees. Do not aspirate with subcutaneous medications. Remove the needle, then release the skin fold. Have gauze prepared to apply over the site. Dispose of the syringe and needle in the sharps container and wash your hands.
Is often avoided because it eliminates time and pain of the injection site, and in the past it was only used for placement. Remember, both an individual's gender and subcutaneous tissue thickness affect the effectiveness of IM injections. Correct needle length for IM injections requires a prior assessment of the patient's weight, muscle mass at the injection site, and amount of sub-Q fat.
When preparing for injection, first, cleanse the skin with antiseptic wipe using a circular motion beginning with the center of the site and moving outward. Next, pull the skin taut and insert the needle using a dart-like motion. Have gauze ready to apply to the site after injection. Dispose of the needle and syringe in the sharps container and wash hands.
About pediatric considerations. When administering a IM or subcutaneous injection, a local anesthetic like EMLA can be given 30 to 60 minutes prior to the injection. During injections, make sure the child is safe and is either sitting in their parent's arms or lying down. When approaching the child, keep in mind their developmental stage. An infant will have stranger anxiety, a preschooler will want to see their parent and fear pain. A school-aged child will be curious about their shot, and a teen will be uninvolved or disinterested.
Therapeutic hugging provides atraumatic care for a child. You can position the child on the nurse or parent's lap and comfortably rest the child underneath your leg. Painlessly hold their arms and their legs so that the shot may be given and the injection will be atraumatic for the child.
In children, the vastus lateralis muscle of the thigh is most often used because it's best developed and contains no large nerves or blood vessel, minimizing the risk of serious injury.
The injection site should not be used on infants and toddlers, only school-aged children older than 3.
Also, giving a subcutaneous injection should be given in fatty areas of a child, and the abdomen should be avoided until they're school-aged when they have enough fat to insert the injection in. Recommended 14 types of immunizations that an infant should have in their infancy.
This can cause a lot of stress and anxiety on part of the parent as well as the child. Social issues and concerns for the adolescent patients surround development of an identity, benefiting from more control over their care, and approaching adolescent patients in the same manner as adults, with respect for sensitivity and needs. You should also maintain adolescent privacy as much as possible. Socially, adolescents may not admit to fears of needles. 10, Center for Disease Control recommends for healthy adolescents 12 to 20 years of age include the following vaccines if not given at ages 11 to 12. Tetanus, diphtheria toxoids, pertussis vaccine, meningococcal, human papillomavirus, and yearly influenza vaccine.
Injections, it is important to landmark the site. For the deltoid, landmark the acromion process and inject 1 to 2 finger breaths below. For the vastus lateralis, inject between the middle third of the thigh, between the greater trochanter. For the ventrogluteal site, place your palm over the greater trochanter and form a V, with the middle finger toward the iliac crest and the index finger toward the anterior superior iliac spine, and inject within the center of the V.
Needles are similar like the elderly population in terms of site and techniques of the needles. Psychological changes associated with the elderly that can impact pharmacokinetics include an increased gastric pH, a decrease in gastrointestinal mobility and gastric emptying time, a decreased blood flow through the cardiovascular system, liver, and kidney, and decreased hepatic and kidney function can also affect pharmacokinetics. The overall body water and protein binding sites and lean body mass is decreased, whereas the elderly patients have an increased body fat.
Intramuscular injections are not recommended in an elderly patient who is emaciated or have decreased muscle mass. Older patients have decreased muscle mass. IM medications can be absorbed more quickly than expected. The absorption of intramuscular administered drugs decreases in bedridden elderly patients because of a change in blood flow. An older patient will probably bleed or ooze from the site after the injection because of the decreased tissue elasticity. Applying a small pressure bandage may be helpful. Some important things to keep in mind when giving injections. The speed of absorption in injection sites differ. The deltoid is medium to fast, the abdominal area is fast, vastus lateralis and ventrogluteal are slow.
Some complications when giving IM and subcutaneous injections are when withdrawing drugs from vials and glass ampules, a filter needle can help filter out particles such as glass, rubber, and other residues. When a filter needle is not used, there is a link between phlebitis, vascular occlusion, formation of granulomas, and septicemia.
IM injections may also be contraindicated in patients with impaired coagulation mechanisms, occlusive peripheral vascular disease, edema, and shock, after thrombolytic therapy, and during an acute myocardial infarction, because these conditions impair peripheral absorption.
The volume of medication 1 milliliter for the deltoid and up to 5 in the vastus lateralis. In pediatrics, you can split the dosages in syringes and inject simultaneously in opposite arms so children will only feel 1 pinch.
When administering any type of medication, use the 6 rights to ensure right drug, right patient, right dose, right route, right time, and right documentation.
Also, don't forget to check your patient's ID band along with the allergy.
Don't forget the 3 checks. Checking the doctor's order to the MAR, checking the MAR to the drug before you draw it up, and checking the MAR to the drug again before you administer your medication.
We hope this video has helped you understand medication regimen and injection.